listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, can you blend a care delivery model with a knack for showing up, being present, or holding space, as they say these days? That is exactly what we're talking about today as we chat with Neil Reich, who's been in the industry for quite some time. During our conversation, we talked about his experience with value-based care, a passion for intentional value, and how those two concepts came together as he created his own agency. I hope you enjoy it. Joining us today, we have a gentleman with over 25 years of experience in the industry, Neil Reich from Care Connect Advisors. Welcome to the podcast.
Well, thank you, Sarah. It's great to be here. Thank you for having me a guest. I'm honored to be here today.
Absolutely. And of course, very glad to have you on the show today to chat a little bit and also pick your brain a little bit. Very curious about your experience and kind of want to get into some of the different areas of focus that you have had the privilege of working in over the past few years. But I think first, let's start with where you got your start in the industry, kind of how you came into the world of insurance.
Sure. Well, I got my insurance license initially in 1990, which is a long time ago, obviously. Started in the P&C space, but I came into the insurance now Medicare Advantage in 1997, started with Humana. And I've been really fortunate throughout my career to work with great companies like Humana, which I think is a leader in the Medicare Advantage space, and especially in terms of how they invest in the growth and development of their people. I worked, 13 years at Humana, worked with a lot of great mentors. Fred Wheeler is someone I consider a pioneer in the Medicare Advantage space who passed away years ago, but was a mentor of mine. And I worked with a lot of other mentors at Humana, Jim Van Ballen, Pat O'Toole, Dan Maltese, to name a few. Had a really great experience in 13 years and was a sales agent, sales manager, national sales manager, which really, in that national sales manager role, was I got promoted to in 2005 in preparation for the Medicare Part D, the advent of Medicare Part D in 2006. And Humana created a strategy. Fred Wheeler created the vision and the strategy to take Humana from 6 states to 50 with that. And I spent those years traveling the country and giving most of today's largest FMOs in the industry their Humana contracts in 2005, 6, and 7. So 13 years at Humana. Right before I launched Care Connect, I spent the last 6 years working with Heartland Financial Group out of Kansas City, Missouri, and led their Medicare Advantage division as well. So, and again, worked with a lot of great people there and a lot of great agencies like Agent Pipeline, and happy to give them their Humana contract in 2005, and Larry Kimball and Ryan Kimball, the Kimball family. And it's just been a great career for me.
Wow, that's pretty cool. It's kind of amazing to think about going back to 2006 with a completely new product in the space and launching that, not really knowing how that's going to go, what it's going to be like, but then also running an expansion from 6 states to 50. That must have been quite the amount of work.
It really was. It was like it felt like we were, for 3 years, we were just traveling at, warp speed, 100 miles an hour. And, traveling. I live in Tampa and my region was the West. So I was doing a lot of across the country travel. And, back then as well, we had to do face-to-face training for agents. I trained like over 10,000 agents in 3 years, face-to-face. So it was a heavy lift. But, when you look back on it, it's a really proud time of my career. Like, I'm really proud of the things that I was able to be part of and build for Humana, and just meet a lot of great entrepreneurs and business owners and learn from them too, learn about, their thoughts and perspectives on business and entrepreneurship. And it's been, like I said, it's been just a great experience and career. So, yeah.
That's pretty cool. So you mentioned a lot of Medicare Advantage, even if it might have started out kind of with the Part D space. What now is your particular area of focus? Are you still very focused in that Medicare Advantage space?
Yeah, I mean, with Care Connect advisors, absolutely. I mean, Medicare Advantage is my bread and butter. It's my foundation. It's what I've done for so long. And I've done a lot. I've sold it. I've recruited agents, trained agents, was a state director. So I was part of the process in terms of like plan designs and filing plans with CMS. So out of default, it's still our go-to and core product. But
Hmm.
with also, I think with the current landscape and the current environment of Medicare Advantage, in doing this for 27 years, I feel like today the future of Medicare Advantage is a little more blurry than it has been in the last 27 years in terms of some of the regulation, a
Hmm.
lot of the changes as it relates to like DSNP and limited SEP enrollment
Hmm.
opportunities for consumers.
Yeah.
Even like the final rule from CMS last year, we talked about admit fees changing. That still hasn't even been resolved yet. I think there's just a lot of uncertainty. So because of that, we've added other verticals to our portfolio of offerings. We're heavily engaged with like IULs right now, Index Universal Life. Fantastic product. We're adding agents to sell annuities. Obviously, I think with Medicare Advantage, the other complementary product is Med Sup, goes side by side, right? So especially if you're marketing to turning 65, you can offer either one, Med Sup and Med Advantage. Now we're also offering hospital indemnity plans to consumers that have the Med Advantage plan. So yeah, I think it's important right now for agencies and agents to really diversify as it relates to if you're in Medicare Advantage. So we're doing that.
Right. I would agree. I think we saw a lot of that just in the past year or two, especially in the Medicare Advantage space, that if you have all your eggs in this basket, what happens if somebody leaves the market? What happens if there's uncertainty? Now it's kind of the flip side of that we're seeing that with the ACA. So definitely recommend to have more than just one product that you are offering. And I mean, really in the long run for agents, it's going to make you a better agent and it's going to make your clients have a better array of things to be able to choose from. So at the end of the day, they're going to have a better experience if you have more that you can actually offer them and they can kind of stick with you and grow with you over time rather than, well, let me get my Med Advantage here. Let me get my hospital indemnity there.
Right. Agreed.
So,
Yeah.
yeah.
And it's part of our name, Care Connect Advisors, and taking more of that role of the advisor rather
Mhm.
than a salesperson selling one product and just be more of that advisor and being able to provide solutions and guidance.
Right. Now, you had mentioned about how you came into the industry. You mentioned creating the Care Connect Advisors agency. What was the impetus behind going from, say, working with a carrier and then branching out more so on your own?
Yeah, great question. And I think it's like I mentioned earlier, like just throughout my career at Humana and helping them lay that foundation in their independent broker channel. And as I said, Fred Wheeler, just a visionary guy. And at the time, Humana was 100% W-2. And in order
Mhm.
for us to scale and go from 6 to 50 states, we knew that we would have to rely on independent brokers. So launching that division and that channel for Humana introduced me to, like I said, Agent Pipeline, Larry Kimball, and the
Mhm.
Kimball family. And I actually gave Integrity their Humana contract. Brian Adams, the founder CEO of Integrity, gave him his Humana contract and and have an opportunity to really pick their brains, pick those individuals' brains and watch them and what they've done. It was just always really intriguing to me. And just I have a tremendous amount of respect for those individuals that start a business and grow it and have success in doing it. I made the decision after I joined Heartland I was there for a little over 6 years and helped grow their Medicare Advantage vertical to be 40% of their revenue and put them in a position to be acquired by Integrity. Just finally made a decision, you know what, I'm going to go do this. I've helped others grow and scale and be successful, and including some agencies that are still part of Heartland, and just thought it's time for me to go ahead and take that. If I'm not going to do it now, when? So I did it in March of 2024.
Honestly, that is a great mindset to have because I think sometimes we get stuck in the planning and preparing phase and when I'm ready, when I'm ready, when I'm ready, the honest truth is you're never going to be ready. Sometimes you just have to jump. You have to do it and you have to trust that you have either, like what you said, that you've taken in all this information from other entrepreneurs over time that, you have not just the knowledge yourself, but that you have the network to help when you run into a problem. That's incredible, I think, to be able to take what you've learned from them and then create that in kind of like your own agency. So when you started Care Connect, was there a different kind of mindset or something that you wanted to focus on, or a different way of doing business that you wanted to focus on rather than what you'd seen previously?
No, I think that a combination, right? A combination of others that I've, like I said, watched and saw them be successful and learned from. Starting Care Connect, I felt like it was important to be consistent. Show up every day with
Mm-hmm.
intention and in purpose, knowing that you don't need to be perfect, but
Mm-hmm.
just consistently show up and have an intention and have a purpose. I feel like we're doing that. I'm doing that. I feel like my team does that. Today we had a collaboration call this morning with several of our partners that were on there. And again,
Mm-hmm.
that's the intention, right? We're just intentionally delivering value to them. Let's get on a call, let's collaborate, let's talk about what's happening in certain markets successfully, or what are some of the barriers that we're experiencing and how do we collaborate together to overcome. So yeah, consistently showing up and having intent and purpose.
You had mentioned in our talk prior to this interview, you had mentioned that you have a very specific focus on value-based care. Can we just get a little bit of a definition for maybe some of those that are newer in the industry, what value-based care is versus the fee-for-service model, and kind of what the ideologies are behind those?
Yeah, sure. I thank you for bringing that up because I do have a strong affinity for value-based care. After my career at Humana in 2010, I was a managing partner of Physicians Group Alliance and an owner in that entity, and that was a value-based care organization. We had 9 clinics in Atlanta, Georgia. And value-based care is a model. It's specific to Medicare Advantage. And I think the genesis of like value-based care started in Florida with Humana and physicians that they had contracts with. Those contractual relationships were sharing risk of managing Medicare Advantage patients that were on Humana's plans. And over time, that evolved into today what we call value-based care because it went from a contractual relationship to groups of doctors or pods of doctors that collaborated and worked together. And then CMS introduced what's called HEDIS measures, which transitioned over to quality metrics. And now that whole model is defined as value-based care. And it really, there's when you talk about value-based care, it's organizations like Oak Street Health and GenMed that work with the Medicare Advantage plans and help seniors manage their chronic diseases. And the data tells us or shows that over 64% of Medicare beneficiaries have at least 2 chronic conditions. And value-based care is focused on helping seniors manage those chronic diseases and conditions to improve the quality of their life. It's a delivery model that's really slowed down, right? It's intentional on being slower and more focused on those consumers. I think that when you talk about value-based care, I think the biggest separation or difference from that and the fee-for-service world that you mentioned, I think all of us can relate to the experience we have at a doctor's office. You have like an appointment at 9 o'clock in the morning, you show up at 8:45, you check in, and the receptionist tells you to wait in the lobby and they'll come get you, in a short period of time. You sit there for 30 or 40 minutes. The medical assistant takes you back to the exam room. They do your vitals. They spend about, 8 or 10 minutes with you. They tell you the doctor will be in to see you shortly, which is another 30 or 40 minutes. And then the doctor comes in and spends 5 or 6 minutes with you, writes a script, and you're on your way. And that's like the fee-for-service world and model that's really, in my opinion, broken. And comparing that to like value-based care, like when you go for your first visit, you spend 30 or 40 minutes with your primary care doctor in a face-to-face meeting, and they're asking probing questions to learn more about the medications you're on, your health history, all of that information to design a care plan or delivery plan that's specific to the personal needs of that individual. I think that that's the way healthcare should be for all of us, not just with seniors that have Medicare Advantage plans.
Right. I mean, I can attest to what you mentioned about the fee-for-service way of doing business. That has happened to me many times where I have had doctors get irritated with me for asking questions or acting like I've done research and I know I know something.
Right. We're just trying to figure out what's going on here.
Right. So you kind of got into the explanation of it, but I'm curious. You had sort of mentioned intentional value as something that you tried to put into the agency that you created when you were growing it. In your mind, what is the difference between intentional value and just a focus on value-based care?
Yeah, so for me, I'm a huge John Maxwell disciple or student, whatever you want to call it. Like I've read most of his books, I've watched
Hmm.
dozens of YouTube videos and presentations from John Maxwell. And what he calls intentional value, how he describes it is that if you're consistently delivering value to people and they see that, they know when they're experiencing or interacting with you that they're taking something valuable away from the interaction or conversation. He says that when you walk into a room, people know that things are about to get better. He's like, that's how he describes intentional value. Like when you're focused on doing that and delivering value consistently, then when you show up, people are like, okay, it's about to get better. And that's what I'm trying to do with Care Connect Advisor. I focus on that intentional value, on consistently delivering to our partners, whether it's an agent or an agency downline,
Hmm.
value. Like whatever that value is for them. Is it like we had earlier today, a collaboration call? Is that important to you? Is it helping you accomplish your goals, helping you do market analysis, helping you recruit agents? We have a book of the month club that is on Tuesdays, and we'll have 30 people on there. And this month we're reading the book from John Maxwell, The Winning Attitude. And
Okay.
we'd go through a couple chapters each episode. Tomorrow morning we'll go over 4 chapters and talk about the chapters and identify a couple nuggets. One of the things that I do with anyone that's new, that's looking at joining Cara Connect as an agent or an agency,
Hmm.
one thing, instead of like me sharing, here's what our value proposition is. Every upline they've created what their value proposition is and they like to share it with the market. And instead of going there, I like to ask people first, like, what are your goals? What do you want to do? Where do you see yourself in a year from now, 3 years from now, and 5 years from now? What are your goals? What do you want to accomplish? And then let's work on a plan together on helping you accomplish what your goals are. And I think doing that, that's intentional value.
Okay. Now, you just explained a lot about that I could definitely ascribe that to being your mantra for doing what you do. But is that what keeps you doing what you want to do? Or is there something different that is your motivation or mindset that just keeps you here and going and pursuing and wanting to do more?
Yeah, I think that's it. I think it's all those things I shared. It's the intentional value. It's the consistently showing up with intention and purpose. And like I mentioned a few times, I've been so fortunate and blessed in my career to work with great people, mentors at Humana, after
Mhm.
Humana, the agency principals and owners that I've been able to work with and develop partnerships and relationships with over the last
Mhm.
25 years. I think from all of those experiences, I've learned a lot. I've learned a lot about our business. I've learned a lot about business itself. And I just feel like, again, starting the agency was like, if I'm not going to do it now, like when? Let's just do it. Because I
Mhm.
feel like I have a lot of experience and insight to share with the next generation. And that's really what does keep me going, is being able to share my experiences, my insight, the successes that I've seen, not just experience myself, but seen others experience and have with that next generation, and doing it consistently, showing up with that purpose and intention.
Okay, so you mentioned insight, and now I have to pick your brain and ask, what advice do you have for someone who is just getting their start in the business?
Yeah, I think that, so my 13 years at Humana, the first 3 years were in sales as a sales representative. The other years were all in leadership. So
Mhm.
anytime in that leadership role, speaking to someone new in the industry, the most important insight that I could share with them is you're going to get out of the business what you put into it. In 1999, in Tampa, Florida, we had a lot of disruption. There was only 4 plans in the market. That's how long ago I started in the business. There was only 4 plans. Today in Tampa, there's like 50. There was 4 plans in the market. 2 were exiting. So half the people in the market had to
Wow.
find a new plan.
Ooh.
And at that time, like any agent that worked in Tampa market could have been the number one agent in the country, but I was the number one agent because I worked every day. It's just, like I said, it's like you're going to get out of the business what you put into it. And I think that our industry is an incredible industry. It gives all of us an opportunity to make a really good income and interact and learn from a lot of great people. And if you stay focused and if you work hard, you're going to accomplish whatever goals that you have, whatever it is you want to accomplish in the industry. If you have a really good work ethic and discipline, you'll accomplish those goals.
Okay, so does that advice still track for someone who's been in the industry for a while? They have maybe a little more experience?
I mean, I think it always does. I think that, whatever you put into, you'll get out of it. But I think as you grow in the business and you've been around for a little bit longer, I think that, to maintain relevance, which I
Mm.
think that's what we want to do, right? We all want to stay relevant in the industry. And I think
Mm.
in terms of like doing that, I really attribute that to three things. One is knowledge. So really just making sure that you really understand the business. And I think that as an agent in the field or as an agency owner, just staying astute as to what is happening in the here and the now in the industry, and at the agent level, being able to articulate and convey to consumers the importance of a 5-star plan or the importance of a chronic special needs plan or the difference between Med Advantage and Med Sup, being able to do all that. So knowledge is one. I think the second one is sincerity. I think that at the end of the day, consumers, they're buying you, the agent. You're sharing a product with them, you're sharing benefits, but they're buying you. And I think that you have to be really sincere in your approach and listen, being patient and listening to the consumers and what their needs are. And then the last one would be talking about the experienced agent, right? Having that advisor mentality, providing solutions that are not just, hey, let me just enroll you on a Medicare Advantage plan or sell you a Med Sup plan, but what are the other needs that you have? Like being that advisor. And if they're on the right plan, let them know they're on the right plan. Go through that needs analysis and identify what their personal needs are and then make the recommendation to them. Again, don't try to sell them, just be that advisor and guide them and help them find the right solution for their personal needs.
Right, right. It's funny that you say that because I keep telling my mom that she needs to review her coverage every year.
Yeah.
And she mentioned the last time that she did it, that her agent told her that she was in the best Part D plan that she could be in for, what she's eligible for, what's in the area, all of that. And I was just like, good.
Yeah,
I'm so
great to
glad
hear that.
it's wonderful to hear that rather than, hearing that they're trying to get her to switch or anything like that. So that's always great to hear that. Now, I know you mentioned a little bit earlier, closer to the top of the episode, you kind of mentioned the current landscape of the industry, some of the disruption we've faced, the issues with regulations, final rules, not so final rules. How can insurance agents, what can they do to adapt to all of those shifting policies? And how can they find a way to ground themselves amidst all that confusion?
Yeah, that's another great question. I think it starts with having that depth of knowledge of your local market, like knowing the local market and the landscape, understanding, like obviously right now, we're past OEP, so we're into lock-in the rest of the year. With the DSNP, there's some markets that don't even have a DSNP opportunity or product offered because they're not fully integrated. So, having that insight and that depth of knowledge and understanding what does that mean, fully integrated, HIDE, FIDE, and the differences of that, and being able to demonstrate that expertise to consumers. But knowing the entire landscape of the market, the products that are available, whether there is a DSNP or not, the chronic special needs plans, like there's some, like I know United has a chronic special needs plan that's available in every county in the state of Tennessee. And then I know like in Ohio, there's a lot of counties that there's no CSNP plan available. So knowing your market, understanding the landscape, understanding the products that are available, understanding the value-based care relationships that exist there, if there are any, and educating the consumer about the importance of value-based care, and then being able to fill those gaps in like we talked about with other products, the ancillary, the hospital indemnity. I mentioned earlier about the depth of knowledge, like depth research is such a great resource for data. Like they touch on so many different levels of our industry and they have great data. And I remember reading one of their reports late last year that for consumers that are turning 65, the two most important benefits are vision and dental. And it's like, without reading that report, you probably wouldn't assume that. You might think food card or over-the-counter benefit if you're not taking the time to study and learn. But, reading that report, okay, the two most important benefits to turning 65 are vision and dental. That's an important part. So like really, really, understanding the entire market, understanding the business, the industry, and then what's available to consumers out there. I think that's really important.
Right. And then also making sure that, okay, if those are the two most important benefits, well, how do those benefits change? Are you letting your clients know if there is a change to that dental benefit, if it goes down, if there's less things that are being covered? Do they know that? Can you get them in a comparable plan if you would switch them, here or there?
Absolutely.
You kind of touched on this a little bit, but I'm curious, in your experience just in the past few months, Are there any misconceptions that you have come across? Maybe just the most common misconception that you come across as you're out in the field that you have had to sort of help educate people about when it comes to Medicare Advantage?
That's a great question. I think that in general, I was actually talking to another podcast host about potentially going on their show, and he was like, I'm just not going to have you on my show because I'm an advocate of MedSup and not Med Advantage at all. I'm against Med Advantage. And we got into this conversation, this discussion that lasted a couple days back and forth. And now I'm going to be going on that show because, he was open to have me on there and just learn and talk more about Med Advantage and the value that Med Advantage has because, and look, MedSup is a great product, right? It's great. You pay a monthly premium. You have no network. You go to the doctor, you give your Medicare card, give your ID card, and you don't see any bills. It's great. But there's definitely a percentage of the population that just doesn't fit for. And for that percentage of the population, Med Advantage obviously is a great fit because it's zero premium and copays. And I think that with that conversation, the misconception with that particular individual was about networks, and the focus being on, well, there's restricted networks and you have a gatekeeper and you got to go to your primary care doctor. It's like, well, yeah, you're talking about HMOs from like 20 years ago. Today, there's local PPO plans, there's regional PPO plans, there's national PPO plans that have in and out of network benefits. So I think that's probably the stigma that's like most associated to Med Advantage is just the network and the network restrictions that are there. But the way that Med Advantage has evolved and the carriers really understanding that stigma and designing PPO plans and offering those to consumers today, I think it's really changed. You see it. We all see it. The percentage of consumers, Medicare beneficiaries that are enrolling in Med Advantage plans here in Florida, it's over 50%. And it just continues to grow every year. So, yeah, I think that's the biggest one.
Right. And I think, too, if you're looking at the difference between someone not, say they're in it because they can't afford the MedSup, if you're looking at it from a standpoint of they either have a Medicare Advantage plan or they don't have coverage at all, what would you rather see from a value-based care aspect? Well, you would rather them be able to have access to care where they're able to have some coverage with, the networks that they have. But again, it's funny when you bring up networks because I do feel like for the under 65 crew, like right now, we've had a little bit more exposure to networks and navigating, okay, I can't go to that doctor anymore because I'm in this plan. Whereas I'm not so sure that was the case 20, 30 years ago. So it's just different. It's a very different evolving landscape.
It really is. And it's not going to change. I mean, it's going to continue. I think in the next 4 or 5 years, we're going to see more change in Medicare Advantage than we've seen in the last 10. There's just so much out there right now. Even from the way, I read an article in January, it said over 70% of enrollments that were done in this last AP were done over the phone, telephonically. Wow. Like that's a crazy number, right?
Yeah.
Really kind of blows my mind. It's like, it just seems so high, but it's probably pretty accurate. Even if it's over 60%, I just think that in the next 4 or 5 years, there's going to be so many more changes and significant changes. I think there's going to be a lot of direct to consumer that happens. I think there's going to be more regulation. I think there's going to be some consolidation of, we talk about over 70% of consumers enrolling over the phone. I think there's going to be consolidation of over the phone sales. It's not going to be just this broad, wide landscape or channel that there's going to be thousands of people participating. I think it's going to be consolidated because there's a lot of compliance concerns around telephonic sales. So I think there's going to be, just to your point, a lot more change happening in the next couple of years.
Right. That's what we are here for. We're here to dive into all of the regulations that CMS puts out and, keep agents abreast of all of that news and keep them able to help serving their communities and their clients. Yeah.
Well, I love it. You're fantastic.
Well, thank you. Thank you so much. Is there anything else that you have that you really want to touch on here today?
Well, what I would like to do is just invite any of your listeners to go to our website. And we've talked about the agency, so Care Connect Advisors. And it's about a month ago. It's crazy because I filed the corporate name and launched the company a year ago. It was in March of 24. Mm-hmm. And just a month ago, the state of Florida came back and said, you can't call yourself Care Connect Advisors because advisors indicates that you're not selling products and you sell products. So you have to change the name. So we're Care Connect Agency, DBA
Okay.
Care Connect Advisors. So we had to legally change the name to Care Connect Agency, which is what our website is. So it's careconnectagency.com. And, go to our website, check it out. If you go to careconnectagency.com/podcasts with an S, there's a playbook. We have a playbook on there, our playbook for 2025. And there's some insights and some guidelines and some tips to agents if they want to be successful in the market and learn how to diversify their product offerings. So we have our playbook available for free. You just go to careconnectagency.com/podcasts and fill out the request form, and we'll email you the PDF version of our playbook.
Very cool. And we will have that linked in the notes as well. So you don't have to worry about writing that down or anything, especially if you're driving. Keep driving. Do not write that down.
Keep driving.
Well, Neil, it has been fantastic having you on today and talking with you. Thank you so much for sharing all your knowledge with us.
Well, thank you, Sarah. Again, thank you for inviting me, and I'm humbled to be on your show. So thank you so much.
Absolutely.
Special thanks again to Neil Reich for the interview. Make sure you visit the episode notes. We have links to the resources Neil mentioned in there, as well as where you can find him online. Thanks so much for listening to this installment of the Agent Survival Guide podcast. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. Special thanks to our guest, Neil Reich. Recording and production by me, Sarah Ruppel. Podcast designed by Urban Rivera. Artwork by Tina Lamoureux. Follow along with our show wherever you like to listen. Like what you hear? Rate our show on Apple or Spotify.